Hello, everyone. My name is Ashley Edwards, and I am a mental health counseling intern at Peacefield Mental Health Counseling Services. So today I'm going to be talking to you parents about mental health for parents specifically and what that looks like, what that consists of, and some coping strategies on better dealing with it. So just some reminders. You can feel free to type questions in the chat box. We will have a question and answer segment at the end of the presentation. So, what we're going to be discussing is what mental health is. We're going to start there. Then, we're going to speak about specific parental stressors. And then we're going to move on to our Q&A. So, what is mental health? Mental health, most of the time, people are using as a very broad statement. And so it's really a positive concept, and it consists of emotions, our psyche, social interactions, and how you cope with it, how you're dealing with it. It's more than just a state of mind. And normally when people hear mental health, a lot of people feel like it has to do with people that are struggling with something or maybe something that somebody was born with or developed over time. But mental health it really consists of way more than that. And in a general aspect, it's how you're dealing with yourself mentally. It's the way that you take care of your health when it comes to your mental and how you cope with everyday stressors. So mental health is integral, which means when we are mentally healthy, we can realize what we're capable of, how to cope with things like work and stress, how to be productive and contribute to society on a daily basis. 1 in 5 adults experienced a mental health concern in the past year. And when I say mental health concern, I don't mean was diagnosed with something or is being treated for something. So a mental health concern is anything that you're dealing with that is interrupting your mental health from being healthy. So, what are parental stressors and what do they consist of? Parental stressors are the distress and pressure parents feel in relation to the demands of parenting. Those can be a variety of things. Um, and some causes can be balancing work and family life, financial pressures, concerns about a child's development or behavior, lack of social support, relationship issues between parents, and other stressors like time demands, working with timing, scheduling purposes with your children or with yourself. How are you maintaining school and after school and doctor's appointments and extracurricular activities and family events, right? Those demands to be on time or be somewhere in general that takes away from your time as a human being can result to parental stressors. A child's safety um, can also result to parent stressors. Thinking about things depending on the child's development, like technology and social media, cultural pressures sometimes, a child's future, all of these things can relate to parental stressors and other things that maybe doesn't necessarily have to do with the child, which can be an economic stressor, employment stressors, things that parents are going through on their own can also affect them. Um, Some other things to note, there are relationship conflicts that when we think of parental stressors, sometimes we automatically feel like it's duties that relate to being a parent. But sometimes it's duties that relate to being to having parents. And what I mean by that is, yes, children cause stress sometimes because parenting is a very difficult job to maintain. But also some parents have to take care of their parents, and that can also be a stressor. So when is it okay to seek professional help? How do you know that it's time to seek help elsewhere? If you felt any of these, this is a sign that maybe it's time to seek um, help so that you can better deal with your daily stressors. If you're feeling less patience and maybe discipline is harsher, or you're feeling more irritable or frustrated, that could be a sign that maybe you need to release some of that stress. If you're experiencing anxiety, depression, or burnout, feeling trapped and inadequate, or having suicidal thoughts, because sometimes it does get to that extent. And we want to try to develop strategies to better deal with our mental health before it gets there. Experiencing sleep disorders, headaches, muscle aches, other health issues, um, and so sometimes you have a headache and it has nothing to do with being a parent. You just have a headache. But sometimes it does have to do with being a parent, and that comes from a list of things that's going on at one time. So you're not getting enough sleep because of parenting. You're sometimes we forget to take care of our own health as parents because you're so focused on your child's health. And even though you should be, your health is also a concern. Um, Increased conflict with partner or feeling emotionally detached sometimes can be signs of needing that extra support when it comes to your mental health. Also, feelings of worry or stress, loss of motivation, feeling like you're barely making it. These are feelings that are red flags mentally to your mental health. And it's showing you that maybe it's time for me to take a break. Maybe it's time for me to talk to someone to develop those strategies that will help me get through my daily life stressors. So these are some uh circumstances in which maybe if you're feeling this, you're experiencing it, and it's not like, okay, well, I got a headache and maybe I want to seek additional strategies. Of course, you can reach out and we'll be more than happy to help you. But if you are experiencing three or more of these, um, three or more of these are happening and it's on a consistent basis, um, then it's definitely time to reach out and seek uh, support. Next time we meet, we will be talking about, we will look more into what types of support can be beneficial for you. What, how do we cope with these daily stressors, even on days where maybe you're not meeting with the therapist or you're not receiving that support? How do you develop strategies to better deal with these daily life stressors to lessen, which is our end result, to lessen the stressors that comes with parenting? Thank you for stopping by today and watching our video on parental stressors. We will look forward to sharing more information with you next week.